go ahead and introduce yourself.
Hello, I'm Dr. Jim Nabzdyk. I am clinic director here for Absolute Integrated Health in Plainfield, Illinois. We have two clinics, one here in Plainfield, another one in Romeoville. Dr. James Nakis is owner of the clinics, and I'm proud to be his clinic director now for about 2 years. I've been in practice for about 26 years, and we have an integrated model, hence our name, Absolute Integrated Health, whereby we provide chiropractic services, and I'm a chiropractor myself, as well as nurse practitioners, physical therapists, physical therapist assistant, and a variety of techs that do soft tissue mobilization. We provide decompression. We provide, of course, the adjustments and the therapies, and a wide spectrum of services that we can provide for patient health.
Dr. Jim, thank you very much for your time today. We really appreciate it. It is really a pleasure to come and work with an IPS client that has been as successful as you and Dr. Nakis have been. We are very excited that you have moved to the osteoarthritis business model, that is the non-surgical treatment of osteoarthritis of the knees and other extremities. And one of the questions that we feel is important to determine to make sure that we are providing the services necessary for you and your success is to determine if IPS and its staff met or exceeded your expectations start to finish.
Yes, IPS absolutely exceeded our expectations from start to finish. It started with you, Carlos. You may recall we had an initial telephone conversation. I was very impressed by your enthusiasm, your level of knowledge, how much you were able to help us understand in a very short period of time what you're all about. I then spoke with Lance, and after speaking with him, I went to Dr. Nakis and said, we got to talk to these guys. He was impressed, needless to say, after we had our conversations together as a group. And then enter in Dr. Domingo, who was fabulous. He came here, he helped us, answered all my questions, came, trained staff, was here anytime I called him, anytime I texted him, emailed him, immediate response, was here whenever we wanted him to be, and very knowledgeable, very helpful. So yes, we were thoroughly impressed.
Dr. Jim, when we had initial conversations regarding the osteoarthritis business model, we talked about the value of physical therapy as part of the business model, not only clinically, but just as importantly financially. I'd like your perspective.
Well, as you know, as chiropractors, we work in conjunction. A lot of what we do with physical therapists, there's a lot of overlap. And so I believe our services are complementary to each other. We have taken on a physical therapist and are glad we have. As you all know, there are certain codes that are provided that are only billed by physical therapists, that are only paid for to have a PT sign off on. So we found that to be beneficial for us financially. Obviously, it's a benefit to the patient as well. We do a lot of different therapies here already anyway, but there are certain things that the patient sees. We're getting additional things being done by the physical therapist that they see that one-on-one. And indeed, they can go ahead and provide those additional services with posture and movement patterns that are complementing what we're doing here.
Dr. Jim, one of the other things that you have incorporated into your practice, which is part of the business model, has been the IPS OA 3000 unloading knee brace. Do we happen to have one available?
We do, actually, yes. We can go ahead and come on over here.
Kind?
Absolutely. Yes.
Dr. Jim, obviously you've chosen this brace because it provides clinical benefits to the patient. Can you kind of give a perspective as to why that brace is important for you and the patient, not only clinically but financially, and how often do they wear the brace after the injection, or how long?
Right. Well, typically what we do with the patient is we assess, first of all, have they had a brace? Seldom will they have one of this quality. We will generally put it on them for anywhere from 3 to 6 hours post-injection. Typically they're wearing that for about the first 2 weeks. Again, depending on tolerance, how it feels to them, what their mobility is, their age, obviously those factors. We like it. Basically, it provides the support, the stabilization. This one is a right, so it's on the lateral aspect. It's going to go ahead and allow for the support to the area. by putting pressure on it laterally to the right. Of course, it's going to open up the medial joint space, which is in many ways compressed. Kelvin-Lawrence scale, many times we'll see people on a 3.5 or 4, which is virtually bone on bone. And so that additional support is going to open up that space and give them the relief, helping to reduce the inflammation. Nice part about this is that you take an Allen wrench and then you can alter that amount of movement either laterally or superior to inferior, and it can be very well fitted to the patient themselves. Good support here. In addition to the actual support on the inside, they have removable Velcro parts that allow us to move them interchangeably depending on the size of the patient's leg. And it also is very well tolerated. So instead of the strap going right into the skin, this provides that additional comfort for the patient there as well. So yeah, it's been working real well for them.
Great. Dr. Jim, as you well know, one of the more important pieces of the osteoarthritis business model is the utilization of digital x-ray and fluoroscopy in order to provide guidance for the injection, and secondly for documentation. And my question to you would be basically this: why did you pick the OrthoScan MDI system for your practice here in Plainfield?
Well, what we looked at is, of course, cost, which we all are looking at the bottom line, as well as convenience, maneuverability, and we felt that, as you could see the size room, it easily fits in this room for allowing our nurse practitioner to maneuver around using it. It's very easily utilizable, very easy to set up. It's just pretty much a no-brainer. Also, whenever we give our presentations, we talk about the 5-prong approach that we take to osteoarthritis. Number one, we use Suparts, which is as natural substance as you can get, with the best properties that are going to be the best for the patient. Number two, we use the physical therapy. Number three, we use the bracing, as we talked about before. Number four, we use it under video fluoroscopy, which is very, very important. We don't guess, okay? And that's very, very important. So when we're doing the fourth point, we always emphasize this, is that in a shoulder or a knee, we use the C-arm to where we can basically put the patient's knee in the area or the shoulder in the area. And then we definitely can see the image on there so that we know that we're going into the area the patient doesn't have any confusion. It's helpful for them. So it really is a good selling feature at the presentation, as well as the fact that the patient can see for themselves, if they choose to look, that it is actually going in there. And so it solidifies in their mind, hey, this is really going to work for me.
If I'm not mistaken, did you not buy a second OrthoScan?
We did. Dr. Nakis owns the clinic, so I'm not privy to the exact amounts, but I know that he's very pleased with the cost of things. And initially, for the initial investment, as we were just getting up and going, as you would as well, we used it interchangeably between our two clinics. And again, it's portable as well. So obviously, in an investment, you're going to take great care to be careful how you pack it up, but it comes very well protected and padded, and we were actually able to bring it back and forth between our two clinics. Once we got up and running and saw the revenue return on investment, we were able to purchase a second unit, and quite affordably being able to have one now here in Plainfield and the other one in Romeoville.
One of the other major points, and it's very important to us as it relates to with Dr. Domingo and his staff from a clinical and training situation, was your staff properly trained well in advance of the first phone call referral arriving into your office?
Yes, I would say our staff was properly trained prior to the first call coming in. It all depends on the people hearing it and them implementing it, of course, and we, of course, oversee that in our positions. But yes, we were prepared once we were ready to go. We felt like we had the supplies as well as the knowledge right to process that person right from the start.
Thank you, Dr. Jim. One of the other things that becomes important as well as we talk about the clinical, as we talk about training, is the importance of the initial investment that Dr. Nakis, yourself, and the clinic made. Do you believe that IPS has garnered you the incremental and profitability you envisioned initially?
Absolutely. I think you provided the opportunity for us to do that. We, of course, have to carry out the procedures, and once we get that patient in, we take care of them and acclimate them. But yes, it has the potential certainly to allow you to get a tremendous ROI.
Has the IPS osteoarthritis modeling allowed for you to see increased awareness and branding for your practice with the attraction of new OA patients daily?
Absolutely. This model has allowed us to provide that familiarity for us to get new patients. Absolutely. We are prepared to understand it ourselves and thereby carry it out through the presentations that we do in the community. And we are getting people coming in as a result of what we're doing. People are obviously referring others and getting results with it. So that, of course, helps. But we do a lot of marketing efforts to go ahead and do that, and we do see that happen.
Dr. Jim, we appreciate your comments, and we hope that we have met your expectations based upon your comments, and we look forward to providing you with more successful business models and modalities that can help your patients and drive revenue to your practice.
Thank you, Carlos. And I would say, absolutely, check these guys out. You'll be impressed, and you'll be glad you did.
And by the way, in finishing, Dr. Jim, would you and Dr. Nackis be amenable to either a phone call, an email, or even a site visit at your facility if one of our prospective clients wanted to contact you?
Absolutely. Absolutely.